Hello and welcome to my video on social media and digital professionalism for healthcare providers. This is aimed at students or people who are entering healthcare professions or have been working in healthcare professions and want to learn more about appropriate use of social media. My name is Jennifer Jackson. I'm a registered nurse and I'm currently a doctoral researcher at King's College London. I've also had experience using social media as a nurse in a management capacity and leading a social media program that way. So I've seen it from a few different angles and I'm here to share some examples. The focus of this presentation is going to be on social media, but a lot of the content applies to whether you're blogging or posting on YouTube or anything else that you might be doing to engage with different tools online. So for our purposes today, social media is defined as any tool or interactive communication tool or platforms that encourage participation and exchanges. So it is important to know that social media, like all technology, is always moving. You know, we went from Facebook to Twitter, now Instagram and Snapchat. There's always new things coming up. So know that whatever tools come in the future still apply to this type of guidance. So just because something new comes along or a different type of technology, it doesn't mean that the standards from the old don't carry over. So be aware that social media is very broadly defined, particularly by organizations that regulate it. So know that as a healthcare professional, we are responsible for maintaining professional image and boundaries. It is always up to us as self-regulating professionals to be the ones who maintain the boundaries, and we are responsible for everything we post. The organizations have provided guidance. There's a million different kinds of standards and guidance and suggestions for using social media and different digital tools. They're all available for free. And so if you don't follow them, it is your fault. It is not the responsibility of an organization to make you read their guidance. You have to do that on your own. So that may sound kind of harsh, but this is one of the ways that idea of self-regulating profession and you being responsible for the practice you provide really, really comes into sharp focus. So it's something that you need to be aware of no matter what you're doing online. You are responsible for making sure that it is professional. So generally, social media does three things: connect, create, and share. And you already know how to do these things offline, and so social media provides an avenue for you to do them online as well. And the next section, I'm going to go through things that for people who are digitally native or have a lot of social media experience, you probably think, yeah, I already know that, and that's fine. What you're going to need to do is there are currently 4 to 5 generations that are either actively practicing in the nursing profession or are involved as professor emeritus or whatever the case may be. So not all of the people who are in nursing are familiar with this. So you are going to need to explain to them why being engaged with digital technology is a good thing to do. And this is maybe some language that you can use. Because if you try and say, oh, because it's up and coming and it's trendy, people are just going to shut down. But these techniques, which I'm about to talk about, might be of more use for you. So why do we use social media? So this example is very English centric, so I hope that anybody who is not English who's watching can take the cognitive leap with me and go the next step. So if we think about different kinds of technology, so I'm going to compare social media to different technologies we've used. So the recent World Cup, here is Gareth Southgate and myself, and with a telephone, long-standing piece of technology, I would be able to call him and congratulate him on a really good World Cup run and a great waistcoat. And so if I were to do that, if I were to call him, we could speak live back and forth, but only the two of us. So we are able to speak live and go two directions, but it's very limited. There can only really be two people. I mean, yes, you can have conference calls and things, but the capacity to go back and forth is limited to about two parties. Okay, so that's the telephone. If we consider the television, if we are watching Gareth Southgate and the English team playing in the World Cup, we can watch them on television, and that can reach large, diverse groups of people, but that only goes one direction. So you can reach many people, but you can't communicate back and forth. You can only go one way. However, when we use social media, we have fundamentally different technology. We can not only reach large groups of people, but we can communicate two directions at the same time. And unlike a television broadcast, where you can reach a large audience, now the audience members can talk to each other as well as the person who is creating the content. So this is fundamentally different technology. This gives us a huge increase in communications capacity that has never been available in human history before. So that's a big statement. It's one I'm confident in because I know that social media is here to stay. It gives humans new capacity that they did not have before. So if you think about how we went from the Model T Ford to all kinds of different cars, eventually the horse and buggy became out of fashion because of that. So eventually printed media may become less in fashion, but that's not going to happen overnight. That'll be over hundreds of years. And there will probably also always be some printed media, such as newspapers or things, because we still have horse and buggies occasionally. They're kitschy, but they do still exist. However, when we look at this, we can say if we think about the driving comparison, we no longer drive Model T Fords. Now we drive much more advanced cars, and maybe we one day won't drive at all. The car will drive for us. However, we are driving now, and although it has evolved from its initial stages, the technique of driving is still used. So sometimes people say, oh, well, Facebook is, going to shut down, or all these different kinds of things. It doesn't really matter whether Facebook continues or not, or Twitter or Instagram or anything else. The Facebook is kind of the Model T Ford. We may still continue to use it, but new things will come along. New different types of social media, new ways of connecting. But what really matters is that we're driving, we're using social media, and we will continue to do so. So when you tell someone who is perhaps of a different generation than yourself that you use social media because it's fundamentally different technology, you're automatically having a different conversation than if you say, oh, well, I can see cute videos of cats. And who doesn't love cute videos of cats? But I'm just saying, when you approach other people and you need to make a pitch for why this matters or why this should be included in your courses or anything else, this is the type of framing I suggest you use. So, moving on, social media can be professional. I think lots of us use it in our personal lives, but it can also definitely be a professional exercise, and not just on LinkedIn or something of that nature. It gives you very broad reach to share cutting-edge health information and expertise. You can connect with different knowledge communities online. For example, if you are interested in becoming a palliative care nurse, there's a whole world of palliative care nursing online, and you can find out more about it without actually having a placement or a clinical session or anything else in that area. You could almost test drive what it's like to be a palliative care nurse through experiences of connecting with others. You can also advocate for your patients and for your profession. There's 1,000,001 bad images of nurses or misconceptions about physiotherapists or physicians or anybody else out there. And so by using social media in a professional capacity, you can have an active part in countering those harmful and stereotypical narratives. So some general guidance for social media and digital technology use. Do not use social media if you are on placement or you are at work. And at the risk of inciting great controversy, I suggest that you do not use your phones at work either. If you are using a drug calculation app or something like that, then you need to make very clear that that's why you have your phone out, and perhaps even say to your patient, I worry greatly that in fitness to practice cases, or when your nurses are taking in front of the regulators or different authorities, if they have used phones, patients may have said, oh, they look distracted. Whether they were or not, that perception may be really damaging. So I strongly advise, do not use social media on placement. Do not use phones in a clinical area, and just be very, very careful of what the patient perception is going to be, because if that patient makes a complaint or has other concerns, there could be significant repercussions of that. So you want to project a professional image and represent your profession well. So by professional image, I don't necessarily mean that you've got a lab coat or, a suit and tie or other formal attire on, but you also want to have pictures where you're not obviously intoxicated, you're not wearing clothes that are really revealing, and you have a right to do whatever you want to do in your personal life, but it is essential that you project a professional image online, because that is what organizations are looking at. That is what your regulator, your college, your association, the government, that's what all of those groups may be looking at if they ever have cause to do so. And potentially it could be what your patients are looking at as well. So it needs to be a professional image. You don't want to air grievances with your organization or your university or your trust, whomever. Don't do that online. There are appropriate channels and there are ways to make complaints or address concerns, and I suggest you do it that way. There legally is the right for an employer to fire an employee if they have bashed the organization online, or for students to be expelled if they have said derogatory things about their university. You don't ever want to find yourselves in these situations, so don't air grievances online. Discuss them through appropriate channels. You want to be mindful of seeking support. Now, social media creates great opportunities for support and for people to connect with each other, especially nursing students who are, going through difficult transitions, and there's lots of support out there. But you also don't want to go online and give the impression that you are struggling to the point where you might not be fit for practice. And so by all means, connect with people and use the technology for that way. But if you are really struggling, don't ask, for support online just kind of for the sake of doing it. If you need to seek support, I suggest you do that offline and through other channels, because again, we have to all consider that day where, if we are sat in front of that council and they're deciding if you get to keep your license or not, if you get to keep your PIN, you don't want them to look on your Twitter feed and say, oh, well, they've been requesting a lot of help lately and they're saying they can barely cope. Can they continue as a nurse? So unfortunately, we have to be driven by the worst case scenario for a lot of these things, but it's important that that I'm honest with you and that you understand the implications of those things. Also, if we're talking about things online, we want to talk about problems, populations, or policies. So we don't want to use specific things like, my patient fell during the winter on some ice and broke their leg. Poor old man, he was really sore and it was really difficult to care for him. We want to say things like, during the winter, when there is more ice, there can be increased risk of falls for seniors or for older adults. How do nurses address this issue? That type of thing. You also want to think about populations. You don't want to say, my patient with breast cancer. You could say, women with breast cancer face difficulties in body image and that type of thing. So you want to think about the population. You also want to think about policies. I suggest, especially when it comes to government officials, that you do not want to criticize them as people, you want to criticize policies. So for example, rather than say, the minister responsible for this and this is a huge jerk, etc., what instead you want to say is the policy about safe staffing is inadequate and patients risk being harmed because of it. The person responsible for this policy is name, and I hope that they will continue to consult with nurses or change their minds about this or that kind of thing. That way you can address an issue and be politically active, which I wholeheartedly encourage, but at the same time, you're framing it in the policies. It's not a personal attack. So this is guidance from the Nursing and Midwifery Council in the UK. Each organization will have its own guidance, but this is probably pretty universal, although you will be responsible to look up the guidance that applies to your area. So do not, this is a bit heavy-handed, but we have to understand as self-regulating professionals, this is the exact guidance from the people that give licenses. So do not violate confidentiality or post anything about patients. You also need to consider, even if you don't post anything that's identifiable, if a coworker could know what patient you're talking about. For example, you say hard day on 6 East, tough to see broken hips. Well, if there was only one patient on the ward 6 East or whatever the case may be that had a broken hip and your colleagues would know who you were talking about, that is an issue. So that's why I suggest you stick to problems, populations, and policies. That keeps you away from potentially violating confidentiality. Do not bully anyone or communicate inappropriately, especially towards organizations such as those who run the train timetables, or political figures that might be behaving as you think very inappropriately. You'll have to find other ways to express concern. Obviously, you can't promote violence or self-harm. We would never want that to happen, so be careful to avoid those things. Don't discriminate against others for any reason, whether it be immigration status, political beliefs, or anything else. Don't offer medical advice. So I think for my first day of nursing school, I had people ask me, can you take a look at my rash? Or when I bend my knee, it clicks funny. They all want kind of different medical advice, but I strongly suggest you do not offer any. You can do things that are in the public domain, such as say, a healthy diet includes at least 5 servings of vegetables a day. That's not medical advice per se. That's generally known. That's general guidance that's available on reputable free websites. What you want to be careful of is saying, Jennifer, specifically, I think you should eat more vegetables because yesterday you didn't have enough. That could be construed as medical advice, so you do not want to do that. You don't want to violate professional relationships, so it is always up to you to maintain professional boundaries. So for example, I suggest that you don't friend patients on Facebook. If they ask for a friend request, I suggest that you do not engage with that, and click the ignore or whatever button may be available. I suggest that for things like an Instagram account, if you're posting personal pictures, you want to keep that private and then screen the people who follow you. You also need to make sure that if people are reaching out to you, that you are maintaining those boundaries. And so you're not providing them any information, you're referring them to different areas. Now this can be messy. If you live in a small community and there's say only 1,500 people there, well, chances are if you have relationships with people and you are friends with them on Facebook, etc., they could very well become your patients. So it gets messy, but at the same time, the underlying statement is you need to be the one to maintain professional relationships. So, for example, if that person, you were in the small community and someone who is your Facebook friend is then your patient, you have to make sure that you maintain those professional boundaries and say, it might be appropriate that you stop being Facebook friends. You might just need to take a break for a while. You might need to reassure them that you are not going to post anything online. And you may say, you know what? This person came in with a broken arm. We set the bone. They are discharged. And likely I will not need to engage with them in a healthcare capacity again. And then it might be okay to continue. However, if they're admitted and you're going to be seeing them on a long-term basis, then it might be a different issue. Sometimes you don't always know. I have over 3,000 Twitter followers, and so as much as I try and be careful, I can't be sure that every single one of them has not been a patient of mine. But I know that if they were to send me a message and request medical follow-up, I would make sure I say no and follow up at that time. You also don't want to engage with any conflicts of interest, so you don't want to be making any money off the fact that you are a nurse by posting things online. This includes like selling any kind of dietary supplements or shakes or anything like that. You can sell things and post that online, that's fine, but you can't say, I'm a nurse and I think this supplement is absolutely amazing and you should take it because of that. Then you're engaging in a conflict of interest, and that could be grounds for removal of your license. There are also gray areas. So in terms of politics, I suggest that people are politically engaged because social media is an incredible tool to use that way. However, based on the current guidance in the UK, I suggest you avoid mentioning directly political parties. So if you want to refer to policies from political parties, for example, in this election, I looked at the health policies put forward by each party. This is a summary of what they said. That's fine. But saying, I am a nurse and I'm voting for X party, then it could be looked upon as though you are using your professional status to endorse a political group, and that you want to stay away from. So if in doubt, I would comment on policies and stay away from comments on specifically on the merit of the party itself or on people within it. It's also hard if you see posts from other people. I can almost guarantee you will see other nurses or other healthcare professionals posting inappropriate things online. And really, to protect patients, you have a duty to report that. However, if it's a good friend of yours, you may want to first send them a message and say, look, I think this is a little bit too much. There's a possibility a patient could be identified, and I suggest you take this post down. I would do that first and try and reach out to the individual. But ultimately, if you're seeing someone post things that are potentially putting patients at risk or violating confidentiality, you have a duty to report it. You want to be careful with your privacy settings. I suggest making all of your accounts private unless they are explicitly professional ones. So my Twitter account is public because it is something I use as a professional tool, as is my LinkedIn, but all of my other accounts are at the highest level of privacy settings. And it's not because I'm posting anything that's particularly inflammatory, but I just want to make sure I know it's always my responsibility to maintain boundaries. So that's how I approach being careful. You also need to consider that like Snapchat says the snaps disappear. Not necessarily. There could be, not to be a conspiracy theorist, but there could be a massive server somewhere that has all of that saved. So I suggest that you just don't engage with that. Even be careful of photos on iCloud or things like that, that anything that's been hacked, our digital lives are getting more and more fragile. So it's something that we need to be careful of. Connecting with service users, I mentioned this a bit before. There can be times where it may be advantageous, like if you're doing research and you want to reach out to people who are carers, then you may be purposefully trying to engage with them, but you need to be very clear about why you're doing that and the limits of that. You're not contacting them to get advice or get their opinions. You're contacting them to see if they would like to participate in a study. You also want to consider past posts. Many of us have a social media life from before we were healthcare professionals, and you need to consider what is shown in those posts, who had access to them, etc., because that is still something that needs to be considered. So for example, I have gone through every single photo of me on Facebook, and it took a long time, but I got burned when I had some pictures from a Halloween party at university popped up, and I had colleagues in management who were my Facebook friends, and they saw them. So after that, I went through every single photo and made sure it was something I would show to my boss. And if it wasn't, I either requested that the person delete it or I removed the tag. So it can be time consuming or daunting to think I have to go all the way through, but you do need to do that. The other option is if you've got an account that's full of debaucherous pictures from university or whatever the case may be, you might just want to delete it entirely and start fresh. So either way, it's your responsibility to make sure that it is appropriate. So on a more positive note, I encourage that you connect with others and find people with similar interests by searching people, hashtags, themes, events, all those types of things. You can use social media to reply to others, amplify their message, and follow people who inspire you. It's a great way to test drive different potential careers or different things you want to try out before actually taking the plunge. For example, I saw posts online of like, should I go back and do my master's? And a whole bunch of different people had weighed in. Now, ultimately, you'd have to make your own decision, but it's a nice way to solicit input from a lot of different people that you might not otherwise be able to connect with. A great example in the UK is the WeCommunities. So hashtag WeNurses, and there's hashtags for many subspecialties of nursing. They have for each domain, adults, mental health, learning disability, and child, there is a specific WeCommunity. So I suggest you look up this website. They have tons of resources. They use social media in a really productive and effective way. And so it's a great way to get started or get started professionally if you're intimidated about where to begin. Hashtags. Right there. So on that drop-down menu, when you're on the website, it gives you access to hashtags people have registered. So for example, you can look things up and find out what hashtag is being used. So an example from critical care is hashtag SMAC, social media and critical care, because in the UK it's called ITU, in North America it's ICU. You know, you can have ER, ED, A&E. There's lots of different acronyms that can refer to similar environments. So they use SMAC, which is a way of connecting across critical care. So this healthcare hashtags can help you find the thing that you are interested in and kind of get the right conversation that you can be a part of. Here are some hashtags that may be of interest to nursing students or other healthcare students. So we've got healthcare leaders, healthcare social media. I'm a big fan of free open access nursing education. There's also FOMED, so an M for medical education instead of an N, MedEd. And there's great We Student Nurses communities. So lots of these have tweet chats. So that's an hour where they have a dedicated conversation using the hashtag. But then there's also times where people just tweet whenever, and you can go along and get some great information. Now, ultimately, if you're applying something into practice, you need to make sure that it's evidence-based and it's appropriate with your organizational policy, but this is a really good place to start. So in summary, I suggest you use social media as an opportunity. It's an opportunity to apply professional knowledge, skills, and judgment. That's what we do with our patients, and it's the same thing we can do with digital technologies. You have an opportunity to reach out to other people. You can share your expertise and also find out about interesting things that are happening with healthcare innovation. You can advocate for your profession and represent nurses and say we are diverse and engaged and we're autonomous professionals, which is a great opportunity. Also, above all, err on the side of caution. If you're not sure about posting something, don't. And just save yourself any trouble and consider, could I show this to my boss? Could I show this to the person who's teaching me? Would that be okay? If it doesn't pass that test, I'd say leave it aside. Thank you very much. I hope this has been useful for you, and happy tweeting or happy posting. If you like, you can learn more about me and my research at the link that you see on your screen. Take care.